To the news now. Doctors have now joined striking health workers to down tools, totally paralyzing a service in public health institution. The Kenya Medical Practitioners Pharmacists and Dentists Union, KMPDU announced the commencement of their strike on Monday, citing failure by the Ministry of Health to address their demands. This is coming even as the Council of Governors claimed some demands by the medics are unrealistic. Purity Musel with that report.
Another strike, more crisis in the health sector as doctors through their umbrella body, the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, downed tools citing neglect by the government as they lead the fight against the coronavirus pandemic.
Doctors across this country today have decided they will not endanger their lives. And I'm saying this because I said it before. It is no to a suicide mission.
After 8 months of talks, KMPDU says none of their demands have been met by their employers, both in the counties and national level.
We need the payment of allowances that we negotiated in 2017 paid. We need provision of healthcare facilities in each and every single county.
The doctors are protesting lack of medical insurance, workman injury benefits and compensation, as well as lack of adequate personal protective equipment.
The doctors today are fundraising, and we know very painful experiences of doctors raising up to 10 million right now just to cater for ICU costs.
Speaking during the burial of their colleague Dr. Stephen Mogusu in Kisii, KMPDU officials said they will boycott work as long as it takes to have their demands met. The situation telling at Nakuru Level 5 Hospital, where patients are seen stranded as doctors boycott work.
Nimekuja hapa kutimbiwa, niko na shida ya matiti na nimekuta hakuna daktari. Nimefika hapa saa 1 mpaka saa hii ndio ninaambiwa nirudi nyumbani ndio hakuna madaktari.
Similar scenes were witnessed at Murang'a Level 5 Hospital Monday, forcing patients to return home unattended. A strike by clinicians and nurses entered third week Monday.
And I really want to ask the national government, Ministry of Health, especially with the leadership of the current CS, Honorable Mutahi Kagwe, I think it is necessary to be a little bit human and say that these doctors, these nurses, these clinical officers, they wake up, go to treat patients who are sick, and they put their lives on the first line just to save our people.
In Nairobi, nurses and clinicians in solidarity marched to the Ministry of Health headquarters in protest.
Just to provide a work environment that is safe for us and our patients, and so that we can be able to see these patients. Go and pay the healthcare workers under contract who have not been paid for 5 months. Is that too much to ask?
But if you continue with your threats, I can assure you, none of the clinical officers and the nurses are willing to go back to work.
Yes. The medics who commenced their nationwide strike on Monday, the 7th, claimed many of their colleagues were dying from COVID-19 due to a lack of both protective gear and health insurance cover. But the Council of Governors, through its chair, Wycliffe Oparanya, is urging striking medics to call off their strike and allow room for talks. Oparanya, who spoke during county COVID-19 socio-economic re-engineering recovery strategy, claimed some demands by striking medics were unrealistic.
So far now, the strike has been declared illegal. So if you have a brother, sister, friend who will continue being on strike, obviously we shall remove them from the payroll. I've directed that we carry out recruitment of other nurses.
Purity Museo, Channel 1 News, Nairobi.